Namaskar, welcome to your channel Travel for Wellness. Health and wellness is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. The pursuit of wellness is a continuous process wherein you make your own choices towards a more successful existence. The motto of Ayurveda guides you in your quest for longevity by adopting the three principles, which are 1. Hetugyana, etiology, meaning the scientific study of the causes of disease. 2. Lingagyana, symptomatology, meaning the scientific study of the symptoms of disease. 3. Aushadagyana, knowledge of therapeutics, meaning the scientific study of the treatment of disease. Do check out part 1 of the Ayurveda series, wherein I have detailed the process of treatment at Amrithakripa Narayana Ayurveda Chikitsalayam in Kerala. The link to part 1 is in the descriptions below. This is part 2 of the Ayurveda series. The doctors are waiting. I have a few questions for them. Let's go. For wellness. I am with Dr. Gokul Narayanan, Dr. Govind Narayanan and Dr. Roshna Govind. I have some questions regarding certain types of diseases. Doctor, I would like you to tell us in detail about this Panchakarma treatment. There is a lot of stuff available online. There are misconceptions about this Panchakarma treatment and there are so many interpretations available. I would like to hear from you what exactly is Panchakarma and how the process is done at this hospital.
Hello, welcome to your channel Travel for Wellness. So as you have told, there are a lot of descriptions given regarding the Panchakarma, and usually whenever they say about Panchakarma, that what you see in the picture is doing a Shirodhara done or a person getting a massage or getting a steam bath done. But actually it is not Panchakarma. These are the preparatory therapies that are done before the person is subjected to a Panchakarma therapy. So Panchakarma are the 5 purificatory therapies. Those are mentioned in the Ayurvedic classical texts, which is the Charaka Samhita, Sushruta Samhita and the Vagbhata Samhita. So Panchakarma are basically 5 purificatory therapies I told you. So these are the medical emesis or Vamana, medical purgation, Virechana, administration of bastis, Sneha Basti as well as Kashaya Basti. This is the enema therapies, and the arine therapies are the administration of medicines through the nasal route, Nasyam, and bloodletting either directly from the vein or by using therapies like Shringavacharana, Jalaukavacharana. These are usually considered as Panchakarma, and this massage, this fermentations like Pirichal Dhara, etc. are done as a preparatory therapies before the Panchakarma therapy is done.
Doctor, I am just interrupting, I would like to know whether this Panchakarma treatment can be administered on people who are normal, who are not suffering from any disease, just to maintain their lifestyle, their body health and the homeostasis, that is everything in the right proportion in their body.
I must thank you for that question, because this is where we understand the value of a science like Ayurveda. So when we study Ayurveda, there is something called as a purpose of Ayurveda. What was the purpose of this whole, the science, Ayurveda? So when they talk about purpose of Ayurveda, they very clearly mention it is very important. It is very, how do you put it, it makes us think, wow. So it says, the first point is Swasthasya Swasthya Rakshanam. Swasthasya Swasthya Rakshanam. And only the second line is Aturasya Vikara Prashamanam. That is where we understand our ancestors were way ahead of us. So what they said first, this is, they never said this is a science to cure diseases. What did they say? The first purpose of this Veda, the first purpose of the science is to swastasya swasthya rakshanam, to maintain the health of a healthy individual. And only the second time are we listening to the second part of it. Aturasya vikara prashamanam. Those who are diseased, let us, take care of their diseases as well. So that is where your question comes in. Swastasya swasthya rakshanam. So maintain the health of a healthy individual. Ayurveda clearly gives us not just treatment but a complete lifestyle. So when we learn about these samhitas, right in the beginning chapters we talk about dinacharya. On a day, what are we supposed to do? As soon as we wake up, what are the things that we are supposed to follow till we sleep? And then comes what is called as a ritucharya. In different weather, in different climate, weather conditions, what are the charyas, what are the things? So that includes the day-to-day activities, that includes the kind of food, the kind of exercise, the kind of drinks that we must take. So that is properly mentioned in Ayurveda. And then, in spite of all this, there could be imbalance in your body. And then comes in the Panchakarma therapies. Okay. So in specific times you must undergo, a healthy man should undergo Vaman therapy. In certain specific climates, the person should undergo Virechan therapy. In certain specific conditions, the person can undergo the MSS, the enema therapy, the Vasti therapy. So those are all very clearly mentioned to maintain the health of a healthy individual. Great. That is the beauty of the science.
Great. Now the next question. There is a gentleman whose wife is having blood pressure, but the blood pressure is uncontrolled. It is very low in the morning, very high after 2 hours, again it becomes very low, then it shoots up. They have tried all kinds of allopathic treatment, but then the blood pressure is not coming under control. It is either very low or very high. All the tests have been done. For blood pressure, is there any relief or any line of treatment we can give to elderly people, let us say 45 plus or 50 plus?
So just as you mentioned in the question, you have mentioned it that the blood pressure is sometimes going down, sometimes going up. So this symptom like kshanat kshinaha, kshanat purnaha, is usually seen in a condition where there is an avarana, or where there is some blockages in the channels. The channels, it means the internal channels through which the life force is traveling. So whenever there is some sort of blockage, it could be a physiological blockage or something. So whenever there is such an avarana in the body, definitely there are chances people get such types of conditions. So definitely blood pressure, we cannot just rule out blood pressure just like a disease, as it is told in other systems of medicine. So also we must look into the other physiological parameters, the blood parameters like their kidney functions, their lipid levels. If all those are very well maintained, then we can definitely, it could be a stress related blood pressure. So we can definitely help with Ayurvedic therapies like Shirodhara. We have found very good results. Patients who are getting their high blood pressure, the blood pressure gets down and it maintains, gets into a good stable condition with therapies like Shirodhara. Along with that, we have some good medicines like Jatamamsi, Shankapushpa and all, which helps in the maintenance of blood pressure. Also, the intake of things like Trifla, also this Shilajatu and all, this helps in maintaining these things to a good control.
What will be the duration for this treatment? Because you will appreciate, coming from a far off place, from other parts of the country to Chittilamchery, it's quite an effort, and therefore they would like to do a lot of planning and would like to know what would be the exact duration of treatment and how many times they should repeat. Do they get relief, full relief in the first course, whether it is 25%, 30% in the first course of treatment, then the treatment has to go on for another 3 years before they find total relief, or we can help them to find some kind of relief. What will be the duration of treatment?
Are you speaking specifically about this person with the blood pressure?
Yes.
So this blood pressure is a variable. So it usually in a normal person also, there would be always some variations in the blood pressure right from a time of rest, after their activity and stuff. So blood pressure is something which is to be monitored and it should be maintained. The therapy that we told, the Shirodhara and all, we can plan it for a 7, 9 or 11 days based on the patient's condition. And once we maintain a good stability in the blood pressure, we can put them on some Ayurvedic medicines. As I told earlier, if there is something like deranged lipid levels, we'll give some medicines to maintain their lipid levels. Also, if there is some kidney related issues, we'll maintain some medicine. We'll be putting them on some medicines that maintains their kidney parameters. So those things should be maintained. Along with that, to control the blood pressure, we'll be putting on some medicines like which contains the Jadamamsi, Sarpagandha, Shankapushpa, etc. So these helps in maintaining the blood pressure. And whatever it is, even if once the treatment is done, we always recommend the people should always keep monitoring it. Not every day, but at least 2 to 3 times a month the blood pressure should be monitored in different times of the day, and they should make sure that it is maintained under control. Usually the diseases like blood pressure, if it is not due to a high lipid levels or due to a kidney disease, if it's a stress related blood pressure, we can usually manage the blood pressure within a 5 to 7 days, and once it is stabilized, and they should be under medication for some more time until the stability of the blood pressure is achieved. And it is also subjective. The monitoring should be very much followed even after the therapy.
Right. Doctor, the next question, this pertains to the knee joint problem. Now, if you see, this has become a common problem, and people are going for solutions like knee replacement. I would like to know from you whether, as per Ayurveda, knee replacement is advised, whether you can give any relief for people suffering from knee joint problem, what will be the course of treatment, the line of treatment and the duration of treatment, and what is the kind of relief they are likely to get, whether it is 1 year, 2 years or 3 years.
So the moment we get into this aspect of treatment and diseases, so we must understand certain basic things, that every human being is different from the other person. See, I keep telling it to my patients as an example. Imagine there are twins, two people, say, of more or less similar, same age, born and brought up in similar conditions. So imagine they come to me with same complaint, and I prescribe them same medications. We can never predict that it is going to act exactly the same way in those two people. So the moment we get into this realm of treatment, diseases and medications, we have to accept that it has to be a tailor made for each patient. So it is very difficult for me to generally give a exact course of treatment or exact days of treatment. So what we generally do here, what we follow here is what I would like to share with you. So what we would ideally want is for the patients to send us whatever available medical reports. Let it be an MRI, let it be an X-ray, and whatever other, and we would want to know their basic medical history. So the general questions we would ask them would be the history of diabetes, hypertension, any other kidney or liver issues, and any other relevant medical conditions. So once, for the sake of this interview, let's say they are all normal and we are talking only about the knee joint condition. Yes, we will be able to give them wonderful relief. When I say wonderful relief, do I mean I'm completely curing them? Imagine somebody of in an age of around 60. Can I make their knees to become like they are in 30? No. But what we can do is make sure that even at 60 or 65 or 70, they are able to carry out their normal day-to-day activities without pain. So along with Ayurvedic treatment, what we can do is, we can improve the strength of their muscles, tendons, bones and ligaments. By providing strength to all this, what happens is, they will be able to carry out their normal day-to-day activities without any pain or difficulties. Thus, we are improving the quality of life.
Yeah. Should I go in for a knee replacement?
Yeah, here. So this is where we must again have to be very, very proper with my answer. I cannot just say no, we can cure everything. No, it doesn't work that way. There are conditions wherein the knee has degenerated so much that total knee replacement is the only choice. So if you ask me, what I would say is, there are conditions where we can treat them with wonderful results. But then there are conditions where we have to accept that total knee replacement is the only option. So I cannot just rule out, I will never say that no, knee replacement is not a requirement. In conditions wherein the knee has degenerated beyond a point, that is definitely a solution. But I would suggest that they should, because it is a surgery and involves whatever risk the any surgery would involve, I would rather want them to undergo Ayurvedic therapies, and only if there is no relief should they consider a knee replacement.
Great. Thank you. Dr. Roshna, now this is for you. And this is pertaining to women who are 45 plus and young girls who are 20 to 30 age bracket. They want to know about hair care, facial care, and how do they take care of their skin, the rashes on the skin. What is it? I mean, I think you would be able to reply and frame it for me. You can speak in Malayalam, no issue.
First of all, thank you for the question, sir. ആദ്യം നമ്മൾ ഒരു പേഷ്യൻറ്റിനെ കിട്ടിക്കഴിഞ്ഞാൽ ഫസ്റ്റ് വി ഹാവ് ടു അനലൈസ് ദ ദോഷ. മെയിൻലി ആയുർവേദത്തിലെ ഏത് ട്രീറ്റ്മെൻറ്റ് ചെയ്യുകയാണെങ്കിലും നമ്മൾ ദോഷ അനലൈസ് ചെയ്തിട്ടാവും ചെയ്യുക. അതിപ്പോൾ ഏജ് ഫാക്ടർ എടുക്കുകയാണെങ്കിൽ ബിഫോർ 20 ഇയേഴ്സൊക്കെ നമ്മൾ കഫപ്രകൃതി കൂടുതലുള്ള സമയമായിരിക്കും. ആഫ്റ്റർ ദാറ്റ് ടിൽ 45 ആ ഏജൊക്കെ പിത്തപ്രകൃതി കൂടുതലായിരിക്കും. അത് കഴിഞ്ഞിട്ട് വാതപ്രകൃതി ആയിരിക്കും കൂടുതലായിരിക്കുക. സോ ഇത് നമ്മൾ ബോഡിയിൽ അനലൈസ് ചെയ്യുന്നത് പോലെ തന്നെ സ്കിൻ കണ്ടീഷനിലായാലും ഹെയറിലായാലും വി ഹാവ് ടു അനലൈസ് ദ പ്രകൃതി ഓഫ് ദ ഹെയർ ടൈപ്പ്. ഈ ഹെയർ ടൈപ്പിൽ തന്നെയാണെങ്കിൽ ഇപ്പോൾ വാതപ്രകൃതി കൂടിയിരിക്കുന്ന പേഷ്യൻസിലാണെങ്കിൽ ഭയങ്കര എന്താ പറയുക പൊട്ടുന്ന, ഇപ്പോൾ ഹെയറൊക്കെ ആണെങ്കിൽ പൊട്ടുന്ന കണ്ടീഷനായിരിക്കും, ഭയങ്കര ഡ്രൈ ആയിരിക്കും. സെയിം തിങ് തന്നെയാണ് സ്കിന്നാണെങ്കിലും എത്ര ഓയിൽ അപ്ലൈ ചെയ്താലും ഡ്രൈ ആവുന്ന ഒരു കണ്ടീഷനാണ്. പിത്ത ആണെങ്കിൽ ഒരുപാട് തിന്നായിട്ടുള്ള ഹെയർ ആയിരിക്കും. കഫപ്രകൃതിയിലാണെങ്കിൽ സ്റ്റിക്കി ആയിട്ടുള്ള ഹെയർ ആയിരിക്കും. സോ ഫസ്റ്റ് ഓഫ് ആൾ വി ഹാവ് ടു അനലൈസ് വിച്ച് ടൈപ്പ് ഓഫ് ഹെയർ ദ പേഷ്യൻറ്റ് ഹാവ്, വിച്ച് ടൈപ്പ് ഓഫ് സ്കിൻ ദ പേഷ്യൻറ്റ് ഹാവ്. അത് അനലൈസ് ചെയ്ത ശേഷം മാത്രമായിരിക്കണം നമ്മളിപ്പോൾ ഏതൊരു ഓയിലാണെങ്കിലും ഏതൊരു പ്രൊഡക്റ്റ് യൂസ് ചെയ്യുകയാണെങ്കിലും അതിന് മുന്നേ ഫസ്റ്റ് വി ഹാവ് ടു ടേക്ക് കെയർ ഓഫ് ദിസ്. അത് കഴിഞ്ഞിട്ട് നമ്മൾ ചെയ്യേണ്ടത് എന്താ പറഞ്ഞാൽ വി ഹാവ് ടു അനലൈസ് അവർ ലൈഫ് സ്റ്റൈൽ. ഇപ്പോൾ പ്രത്യേകിച്ച് 45+ ഉള്ള സ്ത്രീകളിലാണെങ്കിൽ മെൻ്റൽ ടെൻഷൻ, സ്ലീപ്ലെസ്നെസ് ഇതൊക്കെ കൂടുതലായിരിക്കുന്ന ഒരു ടൈമായിരിക്കും. മെനോപോസൽ സിംറ്റംസ് കൂടുതലായിരിക്കുന്ന സമയമായിരിക്കും. സോ ഈ മെനോപോസ് വരുന്ന സമയത്താണെങ്കിൽ അസ്ഥിധാതുവിൻ്റെ ക്ഷയം ഉണ്ടാകുന്ന സമയമായിരിക്കും. സോ അസ്ഥിധാതു ക്ഷയം വരുന്ന സമയത്ത് ഹെയറിൻ്റെ ഇതാണെങ്കിലും കൂടുതൽ മുടി കൊഴിച്ചിലുണ്ടാവും, ഹെയറിൻ്റെ കണ്ടീഷനാണെങ്കിലും ക്ഷയിച്ചുകൊണ്ടിരിക്കുന്ന സമയമായിരിക്കും. സോ
Ideal living conditions are prescribed, but many a times we notice that when you are living in city, when we are traveling, when you are in a foreign land, the ideal living conditions are not possible. We are able to eat food only what is available. And let us say we move out from here. If you go to American countries, nowadays Indian food is available. In Canada, of course, Indian food is available. But in Europe, Indian food is not available. I mean, it's difficult. It's available, but it's difficult. So you have to survive on the fast food and whatever is available there. In such situations, what we can give them or help them to maintain their skin, considering their lifestyle. They are unable to change their lifestyle. So considering the situation or the conditions that they are living in, what is it that you can give as a therapy or as an ointment or as an oil or as suggestions on how to maintain their skin and hair?
ഫസ്റ്റ് വി ക്യാൻ ഡു അറ്റ് എവരിവെയർ. നമുക്ക് എന്താ പറഞ്ഞാൽ ഓയിൽ മസാജിങ് ചെയ്യാൻ പറ്റുന്നതാണ്. അത് ഏത് കണ്ടീഷനിലാണെങ്കിലും ഒരു 15 മിനിറ്റ്സ് ഓയിൽ മസാജ്, ഹെഡ് മസാജ് ചെയ്ത് കൊടുക്കുന്നത് വളരെയധികം നല്ലതായിരിക്കും. അതേപോലെ പ്രാണായാമക്ക് ഹെയർ കെയർ ആണെങ്കിലും സ്കിൻ കെയർ ആണെങ്കിലും വലിയ റോള് തന്നെയുള്ളത്. മൈൻഡ് കാം ആവുന്നതിനനുസരിച്ചിട്ട് ഇതിനെല്ലാം ഹെൽത്തി കണ്ടീഷൻ കിട്ടുക തന്നെ ചെയ്യാം. പിന്നെ കഴിക്കുന്ന ഫുഡാണെങ്കിൽ ഫ്രൂട്ട്സ് നല്ലോണം കഴിക്കുക, വെള്ളം നിറയെ കുടിക്കുക. ഇതാണ് മെയിനായിട്ട് നമ്മൾ ചെയ്യേണ്ടത്. ഹൈഡ്രേറ്റ് ചെയ്തിട്ട് എപ്പോഴും സൂക്ഷിക്കുക.
So you are saying the body needs to be kept hydrated, right? And I would like to know, nowadays girls possibly are against applying a lot of oil on their hair because it becomes sticky, unmanageable. So applying oil, is it required or can they do without it? Is it a necessary component of Ayurveda, that you need to keep your hair oiled, well oiled at all times, or once in a week or twice a week? And what about the skin?
ഓയിൽ അപ്ലിക്കേഷൻ ഒരു നെസസറി ആയിട്ടുള്ള കാര്യം തന്നെയാണ് സാർ. അതിനുശേഷം നമുക്ക് നാച്ചുറൽ ആയിട്ടുള്ള കണ്ടീഷണേഴ്സ് ഉണ്ട്, അത് നമുക്ക് യൂസ് ചെയ്യാം. ഇപ്പോൾ ഒരുപാട് സ്റ്റിക്കി അല്ലാതെ സൂക്ഷിക്കാൻ അതെല്ലാം ചെയ്യാം. നാച്ചുറൽ ആയിട്ടുള്ള താളികൾ കിട്ടും, അതെല്ലാം യൂസ് ചെയ്യാം.
So I would like to add on something to this. So as we were discussing about the Dinacharya and all, in Dinacharya Ayurveda has explained about Abhyanga or oil massage as a general Ayurvedic practice, as a general regimen of life. They have told Abhyangam Acharet Nityam Sajarashramavataha. That means Abhyanga is to be done every day. It helps to maintain to reduce the aging process. So as we are discussing regarding the aging process, and Dr. Roshna has rightly said that we need to apply oil. So application of oil is very much essential to slow down the aging process, be it of the skin conditions or also of the hair. And also Ayurveda strictly recommends, even though a person is not able to do an Abhyanga daily all over the body, what they have suggested is that Shirashravana Padeshu Tam Visheshena Shilayet. You have to apply the oil over your head, in your ears and in your feet. So this is very, very well and very clearly stated in the ancient texts like Charaka Samhita and Ashtanga Sangraha. It is texted, it is quoted clearly. So it is to be done, and we have, if you wish to slow down the process of aging and you said cannot apply oil, I think these things doesn't go hand in hand. So you should compromise somewhere.
Right, sir.
So with respect to that adaptability, so you were talking about ideal living conditions, right? So not just in cities, I must add here. So ideal living conditions are definitely varying, right? With the advent, what do you call it? With the way the whole world is changing. I can never say how my grandfather used to live, I am living, or same with any other person. And the question that you asked, people living in foreign land, I had a very interesting question from one of my patients. He's an Indian who now lives in Switzerland. So he asked me, doctor, this whole Ayurveda thing, so this is made only for Indians. I said no. So Ayurveda clearly says how can you change from one one way of living to the next way of living. So they clearly says a gradual change from one lifestyle to another. So you can go by pada. So quarter you slowly you keep changing, and then when you start totally practicing a different lifestyle, that also becomes satmya, suitable to you, and that satmya Ayurveda calls it oka satmya. So there is no hard and fast rules. That is what we have to understand. Ayurveda clearly gives us all the freedom to choose what is available best. And they say use your yukti, your logic. So when we say we are traveling, so what is available? Fruits are available most in all over the world. So you make use of fruits, and whatever is available there, try to understand the basic quality of it. So this is again very important, because in certain conditions, only thing we can explain it is the principle behind what we are telling. Especially in conditions like rheumatoid arthritis or psoriasis. So they are inflammatory conditions. So instead of me telling them don't eat curd, don't eat non-veg, don't eat this, don't eat that, what I try to do is I try to tell them what is the principle behind it. So when it comes to non-veg, is non-veg a problem? No. Non-veg is heavy to digest. That is the problem. So anything else, so imagine you are taking payasam, it is vegetarian, but it is very heavy. That is as bad as a non-veg. So it is not about veg, non-veg, or that particular product or particular thing. So it is about what is it doing to your body. So try to understand the principle, then try to go by this.
Thank you, sir. Doctor, the next question. This is on skin itching and roughness. Now, there are children who are having a lot of itching on their skin, and the skin is very rough, and they have tried all kinds of solutions, but then they have not found relief. There is a lot of burning, there is a lot of pain also, and I would ask you, what is the solution? Is there any permanent cure for skin problem? Because in one case the skin condition aggravated, they have tried using all kinds of therapies, all kinds of ointments, but things are not working out. What would you suggest for an acute skin condition?
The skin dryness and the skin conditions definitely have a lot to do with the liver functions of the person. So if the person is having any issues with the liver conditions, there could be some skin manifestations. That is one thing. We cannot generalize that any person with a skin condition must have a liver issue. But definitely there is a lot of connection between the liver conditions and the skin. So definitely if we could improve the liver functions and the liver physiological parameters of the liver, to an extent we can definitely help in improving the condition of the skin. Along with that, we should also, as we mentioned earlier, we can use some oils for external application. Also, as the person is said to be having some sort of pain and pain, etc., we can definitely use some hot water fermentations that helps in relieving the pain. So these are the things, but in all these things, we definitely require the patient, at least we get to talk to them regarding the other symptoms that the patients are suffering.
No, you mean to say it is directly connected to the liver function? Is a liver function test required? Should they get it done?
Definitely a liver function. Definitely a liver function test, as well as the testing the vitamin D and vitamin B12 of the patient. These two can reveal a lot regarding the skin conditions. So in persons who have a vitamin D deficiency, to also complain with some certain skin related disorders. Also in people with vitamin B12 deficiency, they too develop some dry skin and other issues. So definitely the liver functions, vitamin D, vitamin B12, all these plays a major role in the skin conditions. And it would be good if the people could get these parameters done before we before we start with the therapies.
Thank you. Doctor, the next question is pertaining to diabetes. Now, if the diabetes is at initial stage, it has just started, can we expect a permanent cure? One. Number two, if it is been there for long years and they are just managing with allopathic drugs, will we be able to provide some kind of relief in Ayurveda?
So with respect to diabetes, the first thing along with the medication, it is very important to properly monitor the levels of diabetes. The first question, initial stages, yes, definitely we can manage. So we have to accept that there are conditions where even Ayurveda has says is manageable. So Ayurveda talks about 4 different types of diseases. Diseases that are susadhya, easily curable. Krichra sadhya, that can be cured but with certain difficulties. Yapya, manageable. And asadhya, it is not curable. So we have to accept that certain conditions come under this category of yapya, manageable conditions, and diabetes is definitely one of those. So with initial stages, we can manage them only with Ayurvedic medications, provided they monitor it correctly. And with respect to sugar treatment, one thing I would always want to tell the patients is the physical distance between the patient and doctor becomes an important factor. Because they have to monitor it, we have to meet them, we have to also analyze them and then treat them accordingly. When it comes to a patient who is under allopathic medications for longer period of time, what we can help them with is to make sure that the complications of the diabetes doesn't affect them. They will have to continue with their allopathic medications, the modern medications. We can give them supplementary medications along with allopathy. If it is not under control, we can help them with our medications and therapies. And with the therapies, one important thing Ayurveda can help is to make sure that the complications will not affect them, be it retinopathy, neuropathy, nephropathy. So with proper Ayurvedic treatment, we can make sure such conditions doesn't affect them.
Yeah. So diabetes, as we are speaking, it is again comes into the spectrum of lifestyle disorder. So in a lifestyle disorder, when we take diabetes, we do not just monitor only the sugar parameters. Along with the sugar parameters, the lipid parameters must be very much looked under consideration, especially the triglycerides, low density lipoproteins. This must be very much monitored during the therapies side. Along with that, the patient must be ready to undergo some lifestyle modifications. As we all know, for a person with diabetes, they should definitely start doing regular exercises. It need not be a heavy exercise or hitting the gym regularly, but they can do some other exercises like going for a walk at least 4 to 5 days a week. A good 35 to 40 minutes of walk is very much required for a person who is suffering from diabetes. Along with that, they should modify their dietary habits like reducing the carbohydrates intake, and they should definitely avoid from usage of sugar in any forms, because nowadays many people are getting a wrong thought that they should avoid only white sugar, and many people are getting into the brown sugar like jaggery powder, and they're saying it doesn't cause diabetes or it doesn't aggravate the diabetes or blood sugar levels. So that is not a right way. People must refrain themselves from taking any sorts of sugar. Carbohydrates must be very well reduced in their diet. They should take more of fibers. They should include more proteins and fibers in their diet. These dietary regulations, along with the regular exercise and the monitoring, we can definitely manage diabetes very well with Ayurvedic therapies and medicines. And therapies like Sarvanga Takradhara gives very good results, especially in treating people with diabetes, where the sugar levels are risen above control. A few days of Takradhara done to the body, within 5 to 7 days, we see good decline in the level of the fasting as well as postprandial blood sugar levels. Thank you.
Doctor, one final question. This is regarding lung fibrosis. She is a 75-year-old lady. The doctor says that the lung is partially damaged. She is on steroids and other kinds of drugs she is taking. Now, I would like to know whether Ayurveda can provide any kind of relief in such severe conditions.
With Ayurvedic proper and right Ayurvedic medications, we can improve her lifestyle. So I can give you example of a patient whom we treated who was on oxygen support for close to 20 hours in a day, and now with proper medications she's still under oxygen support but only for half an hour in a day. So those are the see again here we must understand that we cannot claim that we have completely cured the patient, but with proper Ayurvedic treatment what we have done is we have made a major change in their quality of life. So with respect to lung fibrosis conditions wherein the lung tissues are not able to properly widen, in the sense wherein the sacs are not able to take in the oxygen, the air properly. With proper Ayurvedic medications, what we can do is we can make sure that there is proper the tissue damage is minimal, and the quality of breathing is improved.
It improves.
Yes.
Now, the patient is far away from here. Would you expect the 75-year-old lady to come down here, or if you can courier some medicines to her, it can give some relief and enable her to get rid of the steroids that she is taking now?
The first part is fine. We can once we could get their medical reports in hand, and if with the advent of technology, video calls and things is possible. So that is not a problem at all. And couriering medicines is also a possibility. But the second part of the question, wherein
whether she can withdraw steroids.
yes. So that is something we will have to see. So you see, let us not try to predict the future and claim things that that we are unsure about. So we have to see how is the patient reacting to the medicines. So see, that is where I want the people who are watching this channel to be very, very clear. We must understand that there are no miraculous miraculous therapies or miraculous cure. Ayurveda is a proper science like any other medical science or any other science for that matter. There are things, there is a specific principle behind giving medications. So how the patient react to that medications, there are chances wherein one certain medication doesn't work, we may have to change the medications. So Ayurveda works like any other proper science. So we have to accept that we give the medications, let us see how is the patient reacting, and then let us talk about.
Thank you very much, sir. It was a pleasure speaking to you all. And
one more thing I
yes.
would want to. This is again something I would want the people who are viewing this channel to clearly understand regarding Ayurveda. So again, I want to say Ayurveda is a proper science. So the things just come on an advertisement. This is Ayurveda. Use this for your skin. Use this for your hair. They may or may not work. So if you're looking for any proper cure, be it for a simple skin condition or for a major disease, kindly consult an Ayurvedic physician and only then undergo any sort of Ayurvedic, be it a therapy, be it a medication, be it an application of something. So it is like modern science or any other science for that matter. Ayurvedic medicines should be taken only under a proper medical supervision for ideal results. I must add that, ideal results. Otherwise, you may get results, you may not get results. But if you want ideal results, you must go to a doctor who has done his proper education. Try to understand for what is he giving medications and then take it. I am sure you will get the ideal result possible.
Thank you very much, sir. It has been a pleasure speaking to you. And I would like to say that today if I am standing on my feet, it is because of them. It was a very severe condition, and today I am able to manage my lifestyle. Just like he said, the damage done cannot be reversed, but then the status quo can be maintained. Thank you very much. Bye for now.